Thank you, Margie. February is American Heart Month, and this morning we want to bring awareness to how many people heart disease actually affects. Joining us today to discuss some of the most common causes of heart disease, Dr. Jeremy Tietjens. Dr. Tietjens, thank you for being here this morning.
Thanks so much for having me. I
We are
appreciate it.
glad to have you here because this is something that affects 1 in 4 people.
Absolutely.
Right? So what are some of the top 3 or most common bad habits for your heart?
I would say lifestyle-wise, probably the top 3, most heart unhealthy lifestyle habits. Far and away, number 1 would be smoking.
Okay.
Number 2 would be a sedentary lifestyle, and number 3 would probably be unhealthy dietary choices.
So the 3 you just mentioned, they sound preventable. How preventable are they? What do we need to do?
So those 3 things are pretty preventable. I know it's hard to quit smoking, once you have the habit. After seeing some of those, the pizza and wings for Super Bowl Sunday during that last segment, number 3 is pretty hard. I think we can give people a pass this weekend, but those are all 3 of those things are things that people can change. There are other factors like genetics, who our parents are that we can't change, but those lifestyle things, those are things we can change and really modify risk to our heart.
How about when it comes to exercising as far as cardiovascular, depending on your age? Is it going on an incline, maybe faster, decline? How would that help you?
I would say, certainly age, it can be age appropriate depending on how, someone's age and level of fitness. For older patients that might not have as much mobility, it really just takes, not sitting around. So even 30 minutes, 5 days a week to aim for even just walking, kind of get the heart flowing can be extremely beneficial. Younger patients obviously, might, benefit more from more competitive sports and more intense things, but even light intensity is better than nothing.
Get that heart rate moving.
Absolutely.
Right? So what if you have family history of heart disease? What should you consider?
So all patients, I would say, should talk with their doctor and have, routine blood pressure monitoring, cholesterol monitoring, because those are modifiable factors that are, major, heart, risks, and we can do things about, patients that do have that strong family history might want to talk with their doctor about, sort of more aggressive risk modification like cholesterol control, blood pressure control. There are some other, emerging risk prediction tools like something called coronary calcium score, which can help with early detection of people who are building plaque in the arteries. So there is a little bit of room to individualize, the risk, but kind of talking with your doctor can help guide who's appropriate for that.
We want to touch more a little bit again on some of the healthy habits to consider. What should people be considering in addition to what you've mentioned?
Well, I would say, really, I think the biggest thing is smoking. I mean, like I said, that's really number 1, 2, and 3. But I would say that's a hard thing to quit, once you've already started. So, but there are effective, tools that you can talk with your doctor about, for kind of, assistance, medications, patches, those types of things. So that's such a big factor. I would say, people that are smoking. I know it's a hard thing to quit, but I think it's really important for your heart health.
That's the one you think
I think
you got to
that's
focus on.
number 1. Yeah.
Number 1. All right, Dr. Tietjens, thank you for being here this morning. We appreciate you.
Thanks for having me.
We'll
Appreciate
have
it.
this full interview posted on our website, fox2now.com, but he just mentioned the food, so we might as well go talk about it. Tim, what you got going on?